In this podcast episode with Abigail Shrier, the discussion revolves around the current state of mental health, particularly focusing on the treatment of children and young adults. Shrier expresses concern about the overdiagnosis and overmedication of mental health issues, as well as the negative impact of therapy on young individuals. Shrier highlights the alarming statistics from the CDC in 2016, which revealed that 1 in 6 American children between the ages of 2 and 8 already had a mental health or behavioral diagnosis. This includes diagnoses such as ADHD, oppositional defiance disorder, anxiety, and being on the autism spectrum. She emphasizes that while some children may genuinely be struggling with mental health issues, many are being pathologized unnecessarily. Shrier argues that children are particularly vulnerable to the negative effects of therapy, especially when they are subjected to what she refers to as bad therapy. This type of therapy can make existing symptoms worse or introduce new ones. She points out that children lack the life experience and agency to push back against harmful therapeutic practices. Shrier identifies several harmful practices within therapy, including a hyperfocus on negative emotions, constant rumination on past traumas, and a sense of treatment dependency. She also criticizes the trend of therapists encouraging avoidance of challenges rather than helping children overcome them. Additionally, she raises concerns about therapists promoting a sense of helplessness and inefficacy in young individuals. Shrier highlights the role of school counselors in perpetuating harmful therapeutic practices. She notes that counselors often enable avoidance of difficult situations and encourage excessive rumination on negative emotions. This can lead to increased anxiety, depression, and alienation from parents. While Shrier acknowledges the effectiveness of certain therapeutic modalities like cognitive behavioral therapy, CBT, and dialectical behavioral therapy, DBT, she warns against the misuse of these approaches. She cautions that under the guise of CBT, some therapists may inadvertently promote harmful practices such as excessive focus on negative emotions. The conversation also touches on the impact of social media and excessive screen time on mental health. Shrier suggests that the rising generation, particularly Gen Z, spends too much time online, which can contribute to emotional dysregulation. She highlights the need for less time spent on social media and more focus on real-world interactions and activities. Shrier highlights how platforms like Instagram promote therapy culture and self-diagnosis, leading to a proliferation of therapy speak and a focus on individual emotions. She suggests that the constant validation and attention-seeking behavior encouraged by social media can further contribute to emotional dysregulation and a sense of inadequacy. Shrier highlights the importance of educating children about emotional regulation and appropriate responses to different situations. She criticizes the prevalent notion in therapy culture that individuals should always express their emotions without questioning their appropriateness. She believes that this approach can lead to a lack of emotional maturity and resilience in young people, as they are not taught to differentiate between valid and exaggerated emotional responses. Drawing from her observations in classroom settings, Shrier discusses how young people often struggle with emotional regulation. She describes instances where individuals exhibit dysregulated behavior, such as excessive anger or crying, in response to minor setbacks. She suggests that these behaviors stem from a lack of emotional education and the normalization of overreacting to everyday challenges. Shrier points out a paradox in the treatment of depression, where increased access to therapy and mental health services has not led to a decrease in depression rates. She questions the effectiveness of current treatment approaches and suggests that therapy culture may be exacerbating mental health issues rather than alleviating them. She argues that the language and practices of therapy culture can contribute to a sense of helplessness and lack of agency in individuals seeking treatment. Shrier challenges the narrative that climate change is a primary cause of anxiety among young people. She argues that the fear-mongering around climate change, coupled with the normalization of anxiety in therapy culture, can lead to heightened levels of climate anxiety in individuals. She emphasizes the importance of presenting a balanced perspective on environmental challenges, and highlighting the positive trends in climate-related outcomes to prevent unnecessary distress. Shrier acknowledges the impact of economic instability on mental health outcomes, particularly among young people facing student debt and financial challenges. She discusses how the narrative of helplessness, an external locus of control perpetuated by therapy culture, can exacerbate feelings of anxiety and hopelessness in individuals. She emphasizes the need for a more empowering and agency-focused approach to addressing economic concerns and mental health issues. While recognizing the challenges faced by children in single-parent households, Shrier emphasizes that positive outcomes are possible with proper support and guidance. She highlights the importance of avoiding a victim mentality and instilling a sense of agency and resilience in children raised in non-traditional family structures. Shrier criticizes social-emotional programs in schools for promoting emotional discussions without teaching practical skills for emotional regulation. She argues that these programs often focus on vocabulary and expression of emotions without addressing the underlying issues of emotional maturity and resilience. Shrier suggests that a more balanced approach to emotional education is needed to help young people navigate their emotions effectively. Shrier points out a key difference between therapy for children and adults. While adults can reflect on past experiences with distance and independence, children are more vulnerable to the messages they receive in therapy. She stresses the importance of reminding children that their parents are there to protect them and keep them safe, rather than fostering mistrust in parental figures. Shrier criticizes the overuse of the term trauma in therapy, highlighting a study that shows how individuals who incorporate traumatic events into their narrative are more likely to experience mental health issues in adulthood. She warns against the practice of constantly revisiting past pain and trauma, as it can lead to increased distress and a distorted perception of one's past experiences. Shrier discusses how therapy can contribute to the alienation of young adults from their parents. She notes that therapy sessions can convince young adults to cut off their parents based on feelings of emotional neglect, even in cases where the parents were not abusive. This trend of cutting off parents is on the rise among young adults, leading to strained family relationships. Shrier acknowledges the potential benefits of mindfulness practices in schools for regulating emotions and providing downtime for students. However, she expresses concern about the over-medication of children, particularly with psychiatric drugs. She highlights the dangers of interfering with a child's developing brain and emotional growth through medication, emphasizing the need for caution in prescribing such drugs. Shrier discusses the concept of permissive parenting, where children are given too much freedom and lack clear boundaries. She notes that permissive parenting can lead to children feeling like they are in charge while lacking the necessary guidance and structure to develop emotional resilience. She emphasizes the importance of maintaining parental authority while still being gentle and empathetic towards children. Shrier advocates for a shift in parenting and societal norms to improve children's mental health. She suggests reducing the focus on mental health and wellness, increasing physical activity, limiting screen time, and fostering human connections. She believes that parents play a crucial role in promoting their children's strength and resilience, rather than focusing solely on their happiness. Shrier advises parents to have faith in their children's ability to overcome adversity and face challenges. She encourages parents to prioritize making their children stronger rather than constantly seeking their happiness. She emphasizes the importance of setting boundaries, limiting technology use, and instilling a sense of resilience in children.